You might have heard of the gr8Start Alliance, but what do they actually do? This is gr8Start made simple. The first thing to remember is that the gr8Start Alliance takes a collective impact approach to early childhood development. Parents and service providers alike were finding it hard to understand what services were out there to support families, let alone what was actually needed and how to access them. A collective impact approach works for us because early years services are like a jigsaw puzzle, and collectively we can make sense of the puzzle. The puzzle is made up of many different providers and services, each with different targets, age cutoffs, referral criteria, cost structures, health concern priorities, and the puzzle pieces go on and on. The gr8Start Alliance includes around 50 diverse Gold Coast organisations and services working together to raise happy, healthy Gold Coast kids. Let's hear 3 gr8Start stories made simple.
Hello, I'm Mary. Meet my son, Freddie. At 4, Freddie was having difficulty talking. He didn't really use sentences, and my husband and I were concerned about his speech. But we were sure he'd grow out of it. Apparently, Mrs. Smith, the director from the Early Childhood Education and Care Centre where Freddie went, also had concerns about Freddie's speech. She also felt his behaviour was disruptive to his classmates and he did not listen to or follow instructions. He'd throw tantrums and escalate very quickly, often hitting and pushing other children. Mrs. Smith talked to Jenny, one of the gr8Start PEDS mentors, about one of the most appropriate ways to talk with me about Freddie. After talking to Jenny, Mrs. Smith had a conversation with me, using a tool that asked me about Freddie's development. They called it the Parents' Evaluation of Developmental Status Screening Tool, or PEDS for short. During the conversation, it became obvious we had the same concerns. My husband and I were worried about Freddie, but we didn't know what to do or how much it would cost. However, Jenny and Mrs. Smith explained that not looking into Freddie's issues may have long-term implications for him at school, and there might be some free or low-cost support available. So I gave my consent, and Freddie was referred to the Community Child Health Nursing Team for a more thorough assessment of his development. The child health nurse identified that Freddie would benefit from speech therapy and behavioural support from a psychologist. We don't have a lot of money, so the nurse created and sent an electronic referral to our usual GP, Dr. Brown, asking if Freddie would be suitable for ATAPS, a mental health care plan. This will help us to see a mental health professional, which meant I could get Freddie the help he needed without having to save up. The child health nurse also referred Freddie to the speech language therapy clinic at Griffith University for treatment, without having to wait for a long time. The support Freddie has received has made such a difference to our family. My husband and I have picked up lots of good information from the people we've seen, and we're more confident in our parenting. Freddie is more settled and is no longer disrupting the other kids. Mrs. Smith said the classroom is a happier place for everyone. We've since learned that Gold Coast Medicare Local, through the gr8Start Alliance, funded Jenny and other PEDS mentors just like her who train and support ECEC staff to support families like us. Gold Coast Medicare Local also funds and coordinates ATAPS and provides financial assistance for the Griffith University student-led speech therapy clinic for disadvantaged families. Thanks to the gr8Start, putting the pieces of the puzzle together to get Freddie help was made simple.